Welcome to Week 5 Spotlight Review. The article I researched is called "Is Single Payer the Answer for the U.S. Healthcare System?" Targeted audience is consumers, employers, and elected representatives. The Affordable Care Act increased the number of individuals in the United States. However, approximately 25 million remain uninsured per Fuchs's report of 2018. In his report, he shares his viewpoint on three problems of the U.S. healthcare system: the uninsured, poor health outcomes, high cost. He states that a single-payer system could achieve universal healthcare coverage if the U.S. was willing to accept the practice of subsidies and compulsions, which we are not. A single-payer system might improve health outcomes because the medical care would be more equally distributed, which would decrease the mortality rate of the poor. A single-payer system would lead to low administrative expenses and would have the negotiating power to counterbalance the monopoly power of pharmacy companies, medical device companies, hospitals, and physicians. Four specific areas in doing research were found that would lead to lower health care while improving the quality of health care. And these four specific areas are increased access to affordable and quality health care, keep health insurance costs from growing, reform Medicaid, and promote patient-centered care. Dr. Joyce Nkwanta is one of the steering committees for the organization called Better Choices, Better Care of New Jersey. This is a 401 public education program which is advocating for innovative ways to improve health, transition care, and lower health costs. This committee is in New Jersey, but the information they've come up with would also work in all the states. So what she has brought together is a 15-point plan, and what it comes down to is that under the four major areas, under each area are different points, and it comes up to what it leads up to is called the 15-point plan to lower cost, and then also improvement in the quality of care. So under each area are actions projected to have positive effects. So to increase access to affordable quality care, each state would need to have their own benefit exchange program. They would need to require the uninsured to get insurance. Subsidies would have to be provided to the poor. People that can afford coverage would need to do so or pay a penalty. And then employers with more than 10 employees would need to contribute to a health benefit plan, or they would need to pay a penalty. Under the area of keep health insurance costs from growing, some things would need to have fair pricing for network providers, prohibit drug companies and wholesale distributors from the price gouging, make it unlawful to engage in self-policing at healthcare related state boards, allow nurses, clinicians, and therapists to perform at the level they are qualified, take some of the pressure off of the primary care doctors, prohibit self-funding arrangements in the small employer markets, provide Medicaid and organizations and commercial insurance access to the prescription monitoring program, eliminate unnecessary and costly material requirements. We need to allow electronic delivery. Under the area of reform Medicaid, we need to move behavioral health coverage toward a more patient-centered care system where incentives are provided for health outcomes. Also need to follow managed care principles to increase access to behavioral health care and reduce medical cost. Have a more comprehensive blending of Medicare and Medicaid funding in their program administrations. Each state would also need to have a backup plan in case the Washington lawmakers reduce these programs' fundings. We need to enforce current laws for utilization management for the program. The last area is to promote patient-centered care. We need to provide incentives for quality of care covered by Medicaid and health insurance. So again, the theory of the Better Choices, Better Care project is that consumers are better served by receiving coordinated care among a team of professionals who are working to keep them healthy and not just treat people after they've already become ill. So in conclusion, healthcare has become a topic of intense national debate for years, but that debate has not yielded any significant positive policy changes or lowered the cost of healthcare. Fuchs and Nawanta in their reports have defined a series of measures that through executive and/or legislative action would reduce the cost of care and will enhance the quality of healthcare. Uncertainty from our nation's capital means that many people across the country have seen dramatically higher insurance premiums in 2018 and will probably carry over into 2019. So what's next? We need to be advocates and educate about ways to lower healthcare costs while enhancing the quality of healthcare for all of the U.S., move healthcare towards patient-centered care to prove this is the best way to lower costs and boost the quality of care. Actively advocate for measures that will have an actual and real-world positive impact on consumers. My opinion of this article is that the research convinced me that these actions described by Fuchs and Nawanta will make healthcare in the U.S. less costly and of higher quality and more accessible. And these are my references for my research. Thank you very much.